these substances in the skin, you can actually stimulate them. That's one of the things that glycolic acid does.
I was going to say
One
it
of the things
reorganizes.
that a retinoid does is it increases those substantially. There's other ways we have of doing that as well. And I always say, I don't want another skincare product. I want a solution. Nobody needs another skincare product. We want solutions. So when you're looking at your skin being dry, or you're looking at the large pores, or all these things we've talked about, what you want is you want a solution that actually has some data, medical data, that just demonstrates that it's really going to make a difference.
100%. And so if I remember correctly, Jen, from previous episodes that we recorded together, glycolic acid will really help to reorganize the shingles, right? Isn't that what it does?
It completely resurfaces the skin.
Yeah.
I mean, it. The example that I like to use is there's a skin disease called ichthyosis,
Hmm.
where the scales cells are very disorganized and the skin is incredibly dry. It's not just normal dryness. The person who has ichthyosis looks like they have huge lizard scales everywhere. And
Yeah.
moisturizers don't do a thing for it. Glycolic completely reverses it because it normalizes the cell turnover, but it stimulates those glycosaminoglycans. Glycolic acid is actually chemically categorized as a moisturizer because it stimulates those substances in your skin tremendously.
That's so interesting. I love
I
this
didn't know
stuff.
that.
Okay, so another question. Can retinol be worn during the day?
It can. Now, I'm going to tell you, and I don't know, think this is some new data that I don't think we've talked about before.
No.
So, first of all, if you use a retinoid 24 hours before you go outside in the sun, and let's just
Mm.
say, for argument's sake, that you're using it every night. So obviously you've used it 24 hours before you go out in the sun, that it completely stops all oxidative damage. That is a recent study. Now, the other thing that people, the reason they stop doing retinoids in the summertime, or they're going to go on vacation, is they say, oh, it's going to make my skin sun sensitive. That is absolutely a fallacy. There is study after study, and one of them is where if you were to irradiate skin, where you irradiate it when it's not retinized and it burns, or you radiate it when it's retinized and it burns, that the side that's retinized actually heals faster and heals with less damage.
I
Do
love
not
that.
stop using your retinoids when you go in the sun,
Yes.
because all you're doing is your retinoids reverse this damage, and all you're doing is you're letting all this damage occur. Another example that I use, I have a plastic surgeon in Hawaii, and um, one of the things, and also derms, and a lot of the people that they work with, some of them are championship surfers. They're out in the water all day long,
Yeah.
so they're much more prone to skin cancer, and they have them using their retinoid twice a day to help prevent that. So you can, but you don't need to. That's the key. You don't need to.
So why is it suggested to use it at night then only?
Because at nighttime is usually when you're at rest and you're not exposed to the elements. And I'm not because the elements are bad, but because your retinoid has a chance to sink in and to work unimpaired
Yeah.
by things that you might come in contact with, like friction, or just other things that you might come in contact with, and you're wearing makeup and all of that.
Yeah.
So it's just nighttime is a good time. What it's doing is connecting with receptor sites, alpha, beta, gamma. So you have receptor sites in your skin that connect with the retinoid, and those receptor sites change gene expression. What that means is they actually can correct instructions coming from your DNA. Everything you see that you think is maybe normal aging, and aging is not normal, the appearance of aging, but everything you see that you think is inevitable aging is because the instructions coming from your DNA that your body uses for anything it does, those instructions are compromised. If we could reboot your DNA, everything would reverse. Your eyesight, your heart, your lines, your wrinkles, everything. And those are some things that are being worked on. But that's why we age. It's because of those instructions coming from our DNA. So it can actually correct a lot of those instructions. And that's why it's so miraculous about reversing the appearance of aging.
Yeah, that's pretty cool.
But again, it has to be the right retinoid. People don't understand this, or they use a prescription retinoid, once or twice, and their skin gets red and gets irritated, and then they stop. And our retinoids, we've got to actually have medical study that 78% of patients have absolutely no side effects. None, zero. And about 22%, maybe they get a little bit of redness or a little bit of flaking. Nothing that's that disturbing, but we just say, hey, well, then just start off every other night.
Exactly.
Not a problem.
Acclimate a little bit more if you have that,
Yeah.
that tendency. I'm one of those people. I was using the Marini Luminate regular, and I've moved to the Marini Luminate MD, which has a higher percentage of retinol.
Mm-hmm.
And yes, I started to apply it too often, but I'm very like, and so now I just do it every second night, and until my skin gets used to that, and then I'll bump it up to every night again.
Yeah, it's real simple.
Yeah.
And those are things that, they really make a huge difference.
They do. Yeah. It's
Amazing.
so cool.
How often should I be exfoliating my face?
Okay, so great question, but I don't like the term exfoliate, because when you look at the definition of exfoliate, it's usually some type of manual friction.
Yeah.
So that
like little beads or something, right?
Yeah, it can even be really fine particles, but what they do is they create microscopic tears in the skin. They cause inflammation. Aging is an inflammatory process. It can also exacerbate acne, exacerbate discoloration, on and on. What you want to do is you want to resurface every single day. And resurfacing is where you're constantly keeping those cells completely organized so that they reflect light, your follicles looks nice and small. It's also going into the follicles, so it's helping to interrupt the acne process. You want to resurface. So that's
Daily.
glycolic, salicylic, azelaic, those types of topical agents.
But so you want to do this daily?
That's every day. I do it every day and every night. So I wash my face with the bioglycolic facial cleanser, and then I use the BioClear day and night.
Mm-hmm. Me too.
I do too. Okay, so that's important to note. So like,
We're both
don't.
greeny girls.
Yeah, we're all like, you can't even blame
really
me.
are.
I just had to restock on my BioClear. I was out for 2 days. I'm freaking out. It's like a disaster. But it's so if, let's say, somebody like doesn't have these products at home and they're using a product that has the micro beads in it or the little jojoba oil, like whatever it is that people put in to get that sort of like exfoliation, mechanical exfoliation outcome, like should they be doing that? Like should they be doing that
at all? Shouldn't be doing it at all. If I line up 10 dermatologists, I can just tell you virtually all 10 of them are going to say you do not want to do that.
Okay, interesting.
Because again, it creates microscopic tears in the skin. It creates inflammation. It aggravates aging. It aggravates discoloration. It aggravates rosacea, and it aggravates acne.
That's very interesting.
Now, if you've got something where the beads dissolve, maybe you can do that occasionally, but most of the time that's not what occurs with those products, if they're not dissolving beads.
What about enzymatic?
Yeah, I was just about to ask about enzymatic.
Enzymes are different, but
like,
you shouldn't have beads with enzymes. Enzymes digest dead and diseased tissue. They can't hurt normal living tissue. So when our docs, for example, use Cleanzyme Skinzyme, which is a proteolytic enzyme, after somebody gets lasered, so imagine your skin is raw, but what happens in a couple of days is you got a lot of dead skin and particulate, and it just doesn't feel very good. they actually have patients use that. It eats it all away and it doesn't hurt that tissue that's not healed. Imagine putting a scrub on your face at that point.
I used it, Jen. I did an ablative procedure a couple of years ago, and
Uh-huh.
when you have that sloughing of the skin kind
Yeah.
of afterwards, and I used the Clean Sign Skin Zyme, and I
Yeah.
masked, and it totally like helped to just very gently remove everything. It was amazing.
I think I need to go into the warehouse and restock on that too now.
And the other thing I will tell you about the proteolytic enzyme is that when you're doing that very consistently all the time, you're encouraging a lot of collagen production. You're encouraging a lot of your skin to turn over much more rapidly. And it just progressively over time, it gets better and better.
I know. Yeah. Consistency is key, right?
Mm-hmm.
Consistency is key.
And frequency in some cases.
Yeah, absolutely.
I sound like a broken record when I talk about Jan Marini, but I can't help it. I'm genuinely in love with this brand. Jan Marini is a recognized leader and innovator in skincare, always pushing the boundaries to elevate the professional skincare market. Their skincare management system has transformed my skin, and it's no surprise it's been named the best skincare system for 12 consecutive years. From cleanser to sunscreen, Jan Marini's complete skincare kit has everything you need for a healthy, youthful-looking skin. Personally, Jan Marini is the only brand that has effectively controlled my melasma, which is one of my biggest skin concerns. And over the years, I've also noticed significant improvements in my skin's texture and radiance. Her brand truly offers solutions for all skin types and concerns. We have Jan on the podcast regularly, and her wealth of knowledge is incredible. No wonder her products are some of the best in the industry. If you want to try these products, go to bskinenvie.ca. That's BSKINENVIE.ca and use code SkinTalks to get 10% off your first purchase.
Okay, another question that I have is, does blue light from computers, tablets, phones, etc., cause premature aging of the skin?
The jury's out on that, but what I can tell you is that there was a study that was done, a medical study, where if you sat in front of your blue light, and I can't remember if it was like 24 hours straight for a week, and you just stared at the screen 24 hours straight for a week, that it was the equivalent to one exposure at noon time to 1 minute of sunlight.
Sunlight.
Because 50% of the light that we only see 50% of the light when we're out there.
Yeah.
The rest of it is mostly blue light.
Okay. So there's nothing definitive that really.
Nothing definitive, and you can't. I just think that there's so many other things. People will worry about sitting in front of their phone or their computer screen, but not wear a sunscreen indoors.
I know.
Okay, not go outside with the sunscreen. It's so much worse. It's so much worse.
Yeah.
And it's not just the cosmetic issue, it's the health issue, because of all the cancers that people get. Do you know the ones that have the most potential to be fatal? One of the cancers is malignant melanoma.
Melanoma, right?
So people recover from breast cancer. People recover from but at least for the most part, at least 50% will die of malignant melanoma, when the rates of recovery oftentimes are much higher for these other cancers.
Yeah, it's a tough one. I've often heard that before too.
Yeah, really. It's intense.
Yeah.
I want to know, what are broken capillaries and how do we get them?
Okay, broken capillaries actually aren't broken.
Oh.
So if they were broken, you wouldn't be able to see them if we could somehow keep the blood from flowing through. So they're dilated capillaries. They're telangiectasia. The reason those capillaries are there, they've been there the whole time, they're dilated. So they are much more noticeable. Now, dilated capillaries can happen for a couple of different reasons. Sometimes you get a few of them around your nose, and it's from sun damage.
It's sun damage.
But the other way in which you have more noticeable dilated capillaries, known as telangiectasia, that's with rosacea. And that's when the skin is much more obviously red, and it's, red can either be on a transient basis, or as it progresses, it can be on, pretty much full time.
Yeah. Yeah. Okay. Interesting. And so we have one last question for you, Jan, which is what is the best makeup to wear to avoid breaking out?
Okay. So I used to actually keep lists of makeup because so many makeups were comedogenic, meaning acneogenic.
Yeah.
And today, most makeup lines have been really good about removing acneogenic, uh, you know, ingredients.
Yeah.
So, for example, Clinique, just about, and they have a wide selection of makeup. Even Tom Ford does a good job with makeup. Armani does a good job. Charlotte Tilbury. I mean, almost every brand out there. So it's a matter of preference. And a lot of times people think, well, your makeup is making you break out. No, if you're not doing something every single day to prevent the acne, if you're not on a program, I don't care what makeup you wear, you're going to break out. So with that said, we also make a tinted sunscreen,
Mm-hmm.
which for a lot of people acts as their foundation. Now, the idea is that you want to get to the point where your skin is so clear that you don't, foundation is optional. I'm not wearing any foundation. But if I were going to have a day where I felt like my skin need a little bit more polish, I would wear our SPF 45. It comes in 3 different shades. And by the way, guys, it used to come just in a one so-called universal shade.
Mm-hmm.
Now we have light, fair to light. We have light to medium, which is the universal shade. And then we have one that goes medium to deep, which covers the whole other spectrum, as dark as you want to go.
Okay, so
And
are they available in Canada, Jen? Do you know?
I'm not certain because there's so many different regulatory aspects
Yeah,
to
I'll have to
for
find
things
out.
that are sunscreens. Now it is a physical screen, so I'm not certain about that,
We'll
but
find
it gives the skin just this beautiful polished look, and it gives it kind of a stained glass appearance. It actually kind of fuses with the skin, and it also has our microscopic sponge oil capture system, which has an unlimited ability to capture oil without capturing water or the active ingredients. And so if you've got oily skin, so balanced, and if you've got skin that's on the drier side, it's at least really nice and soft and silky.
I've personally experienced that as well with people with the oil capture system in your sunscreens is very good for acne prone skin. Like people really enjoy that, and also all skin types basically.
But
Well,
the thing is that, guys, you want to stay away from ingredients that for makeup, any kind of like coconut oil or isopropyl myristate, which is a synthetic oil, isopropyl palmitate. They used to put those in there because they could put them in and call the product oil free, but they were highly acneogenic. I don't see that anymore. I really don't see it anywhere near as much.
Amazing.
So
That's
sometimes powder makeups are actually worse. We tend to think that they wouldn't be because it kind of dries on the skin. But what happens is, and one of them, I hate to call this one out, but every single time I used to train, I don't do this anymore, but I used to train our sales executives. And when they would first come in for training, and a lot of times they would have acne, and it seemed like 9 times out of 10 when I asked them what makeup they were wearing, it was by MAC. It was the powder makeup by MAC.
which is like a huge seller, I'm assuming, for MAC, right? Like I think
everybody's using
But it can also kind of create a yeast condition on the skin too, which can be a underlying causative factor in some acne. And it just, I don't know if it's, well, there's some acneogenic ingredients there, but it just seems to occlude the skin in a way that it exacerbates it. But again, there are other makeups by MAC that are great.
Yeah.
So for the most part, you don't have to worry.
Yeah, and I would imagine that if you have acne-prone skin, also applying with a brush, if you're not cleaning your brush every single day, you're also like
Well,
best thing.
yes and no.
Okay.
Because again, what that denotes is, oh my gosh, somehow I'm creating dirt or bacteria. And acne is not caused by dirt. If you didn't have any genetic tendency to acne and your skin was perfect, you could throw dirt on it all day and you wouldn't break out.
But what about if somebody
It's
has,
C. acne bacteria.
yeah, what about if somebody has active acne and they're applying that but using a brush and the brush gets touches
But the acne is caused by the C. acne bacteria, which is in part of your body.
yeah.
So could you infect your skin? Maybe, but it's really not. You want to clean your makeup brushes, and preferably, I prefer, if I'm gonna ever do any kind of foundation or anything, I'd put on with my fingers. But
Interesting.
Yeah.
you should keep your makeup brushes clean one way or the other, because
Yeah,
it's not
absolutely.
just that bacteria that causes acne; it's other kinds of bacteria.
Absolutely. This has been so fun, Jan.
I
always,
learned so much.
yeah, we got through a lot of questions.
Yeah, we did.
And a couple extras that we threw in there. Thank you so much for joining us today and going through all of these. I think this is so helpful for people because, again, we talk about what's available through social media and friends and just people saying these things, and then we pick up on it and we think that's the truth. So it's really nice to kind of dissect these myths, so to speak, or these situations to be able to get some truths out of it. So thank you very much.
Thank you. It's fun for me. I love getting all these questions and everything. So thank you.
Thank you. Thank you. We'll be happy to have you back for sure.
Okay, guys. Thank you. Bye, everybody.
Bye.
Thank you so much for listening. If you enjoyed the episode, please take a moment to rate, review, and follow us on social at Skin Talks Pod. We'll see you next week.